to clean body site. Alam nga naman yun ang ginamit mo sa contaminate, gagamitin mo rin sa clean. So, you have to change also. And now, if a pin or other sharp objects is used to assess sensory perception, discard the pin and use a new one for your next client. So, dapat talaga, kung anong ginagawa sa pasyente mo, dilinisin mo bago mo gamitin sa iba. Or, kapag disposable naman, huwag mo nang gamitin. Okay? Kung disposable din naman. So, ibig sabihin nun, isang gamit lang. Wear a mask and protective eye goggles if you are performing examination in which you are likely to be flushed with blood or other body fluid droplets. So right now, because of the COVID-19 pandemic, you are really required to use your face mask and your face shield. Okay, now approaching and preparing. So, you have to establish the nurse-client relationship before the physical examination para wala tayong mga tensions or something. Alam mo yun, para at least assured yung client mo na mapagkakatiwalaan ka. And you then, you are already prepared na alam mo na yung gagawin mo. Now, ito yung galing sa Center for Disease and Control and Prevention, the CDC, and Healthcare Infection Control Practices Advisory Committee, Isolation Precaution Guidelines. So, importante alam natin to kasi different kind of precautions need different kind of safety equipment too. Okay, so we have the standard precaution. So, ano ibig sabihin ng standard precaution? Normally, ginagawa natin pag standard prec lang yung pasyente, we always assume that every person is potentially infected or colonized with an organism. Kasi usually naman, dapat lagi din i-assume yan na pumunta sila sa hospital kasi may problema sila. We don't know what is it yet kasi we are doing assessment pa. And then, syempre, katulad din sa COVID, di ba? We have like PUI. Kapag nagpa-swab siya, ibig sabihin, we know that probable na pwedeng meron siya nun. So, for us, we have to treat them like meron sila. Para at least ma-protectionan mo yung sarili mo. And then, once na lumabas na yung result nila, naging negative, doon lang tayo ma-assure na, he's negative from COVID. So, ganun din sa mga pasyente natin. We always have to have the standard precaution always. So, kasi we have to assume that every person ay meron at least na organism that could be transmitted to you as a healthcare worker. So, you have to apply the following infection control practices during the delivery of the healthcare. So, first thing first, our favorite one is the hand hygiene. So, during the delivery of the healthcare and unnecessary touching of surfaces in close proximity to the patient, to prevent both contamination between you and the client, you should always clean your hands. You have to wash your hands. Okay? And also, lahat ng hawakan mo, kailangan magugas ka rin ng kamay. So, when hands are visibly dirty, kailangan mo din maghugas ng kamay. Contaminated with proteinaceous material or visibly soiled with blood or body fluids, you have to use either hindi naman na-require talaga na gumamit ka ng antimicrobial soap. You can use any kind of soap, antimicrobial soap and water or antimicrobial soap or water. So, it depends na rin sa preferences nyo or kung ano available sa hospital. Pero, much better pa rin talaga na tama yung hand washing technique mo. Kasi kahit sabihin mo may antimicrobial soap ka, kung hindi naman tama yung paghugas mo ng kamay, so wala din kwenta. May matitira pa rin diyang bacteria. Okay. If hands are not visibly soiled, ano dapat gawin? Or after removing visible material with non-antibacterial decontaminate hands in the clinical situation described later, the preferred method of hand decontamination is with an alcohol. Alcohol-based hand rub. Alternatively, hands may be washed with an antimicrobial soap and water. Frequent use of alcohol-based hand rub immediately following hand washing with an antimicrobial soap may increase the frequency of dermatitis. So, perform hand hygiene before having direct contact with the patient. Ano ba? Ayun pala. Kailan ba dapat tayo nag-hand wash? So, we have here, before having direct contact with the patient, maghugas tayo ng kamay. After contact with blood and body fluids and excretion, mucous membrane, non-intact skin or wound dressing, we have to wash our hands. And then, after contact pa rin with patient's intact skin, when taking the blood pressure, the pulse, or lifting the patient, we have to wash our hands. And also, if our hands will be moving from contaminated body site to a clean body site, we have to wash our hands. Okay? And also, after contact with inanimate objects, including medical equipment and immediate vicinity of the patient. So, the patient's surroundings, kapag hinawakan mo yan, after that, you should also wash your hands. And then, after removing your gloves, even though you have your gloves, when you remove your gloves, you should wash your hands. So, ganun. Now, you have to wash your hands with antimicrobial soap and water or with antimicrobial soap and water if contact with spores. So, ano yung mga spores? Example, yung may mga Clostridium difficile or Bacillus anthracis is likely to have occurred. So, kung tingin mo may ganun siyang bacteria, you have to wash it with antimicrobial soap. The physical action of washing and rinsing hands under such circumstances is recommended because alcohol, chlorhexidine, iodophores, and other antiseptic agents have poor activity against spores. Now, do not wear an artificial fingernails or extender if duties include direct contact with patient at high risk for infection. Kasi syempre, pwede yung sumingit-singit sa mga nails mo. Those on intensive care units or operating rooms. So, yan. And develop an organizational policy on the wearing of non-natural nails by healthcare professionals. Actually, bawal talaga. Yung may karoon kang cutics or meron kang mga false na mga nails. Pero kasi syempre, sobrang ngayon na, parang pag matagal ka na nurse, parang, okay lang, ganyan. Pero actually, mas ideally talaga, dapat short nails and then talaga na trimmed or na cut siya. Para at least, syempre, para hindi ka rin ma-prone sa mga infection. Okay, so now we have the personal protective equipment or the PPEs. So this one is very common now na ginagamit. So observe the following principle of use. So wear the PPE. What are the PPE? The personal protective equipment. So we have the gloves, the gown, the mouth, nose, or eye protection when the nature of the anticipated patient interaction indicates the contact with blood or body fluids, or kapag gumagamit tayo na kapag alam nating probable suspect siya ng COVID. So, yun. Prevent contamination of clothing and skin during the process of removing PPE kasi may right way how to don and to remove it. Before leaving the patient's room or cubicle, remove and discard PPE. Ngayon nga, kapag kunyari nag-duty ka sa mga COVID area, required ka din na maligo pagtapos ng duty mo. Kasi syempre, para talagang sobrang linis mo na pagkatapos ng duty mo. So, that's the thing too. And also the gloves. Wear gloves when it can be reasonably anticipated that contact with blood or other potential infectious materials. Because remember, sabi ko nga, lagi gagamit ka ng gloves kapag alam mong hahawak ka ng mga sputum or kaya mga body fluids, blood, ganyan. So, also, you have to wear gloves with fit and durability. So, syempre, required talaga na gamit tayo ng gloves na sakto sa size natin para hindi siya, alam mo yun, hindi tawag dito, nangalay na kasi ako, sorry. Na fit sa atin. At syempre, dapat durable din siya para alam natin hindi siya mabubutas while doing the physical examination. And also, kung much better, mag-double gloves para mas safe. Para at least kung mabutas man yung unang gloves mo, nag-touch the patient, at least meron ka pang isa sa loob. Okay, wear disposable medical examination gloves or reusable utility gloves after contact with patient or the surrounding environment, including the medical equipment that you use. And do not wear the same pair of gloves of care for the care of more than one patient. So, lagi ka magpapalit. Pupunta ka sa ibang pasyente. Change gloves during patient care. Okay? If the hands will be moved from a contaminated body site, so ulit lang. Gowns. Anong gagawin natin sa gowns? So, ngayon sa gowns naman, we have to wear gown that is appropriate to the task to protect the skin and prevent soiling or contamination of clothing during procedure and patient care activities when contact with blood and body fluid secretion or excretion is anticipated. So you have to wear a gown for direct contact if the patient has uncontained secretion or excretions, and you have to remove gown and perform hand hygiene before leaving the patient's environment. Do not reuse gown, even for repeated contacts with the same patient. Okay? Isang gown, discard. Pagpasok uli, gown uli. Paglabas, discard. Ganun. Kahit sa isang patient mo lang panapasok yun or ginagamit, once na lumabas ka, discard. At bawal ka na pumasok sa nurse station mo, nasuot-suot mo pa rin yung gown. You have to remove it right after you use it. Like, tapos mo sa patient, meron dapat na bin dyan kung saan mo ilalagay yung mga used na gown. Routine donning of gloves upon entrance into a high-risk unit like the ICU, neonatal intensive care unit, or NICU, or hematopoietic stem cell transplant unit is not indicated. Syempre, alam mo naman, mga doon, masyadong mababa ang kanilang immunity. So, kailangan sobrang todo ingat. Mouth, nose, and eye protection. So, use PPE to protect the mucous membrane of the eyes, nose, and mouth during procedure and patient care activities that are likely to generate splashes or spray of blood, body fluid, secretion, and excretion. Select mask, goggles, face shield, and combination of each according to the need anticipated by the task performed. During aerosol-generating procedures like bronchoscopy, suctioning of the respiratory tract, if not using inline suction catheters, and the tracheal intubation in patients who are not suspected of being infected with an agent for which respiratory protection is otherwise recommended. So, depende kung anong klase yung gagamitin mo na ano. Pero ngayon kasi required talaga na full face shield, not only goggles. Para protection na rin. Wear one of the following: a face shield that fully covers the front and sides of the face, or a mask with a touch shield, or a mask and goggles. So right now, dahil nga sa COVID, we are advised to use a full face shield. Respiratory hygiene, cough etiquette. So now, syempre, pag ikaw inuubo, lalo ngayong panahon ngayon, we have to also be careful when we are coughing. So, educate healthcare personnel on the importance of source of control measures to contain respiratory secretions to prevent droplet and mite transmission of respiratory pathogens, especially during seasonal outbreaks of viral respiratory tract infection. So, example, the influenza, respiratory syncytial virus, adenovirus, parainfluenza virus, and coronavirus in communities. Implement the following measures to contain respiratory secretion in patient and accompanying individuals who have signs and symptoms of respiratory infection. Ano ba yung mga signs and symptoms? Usually, may cough. O kaya may cold. May fever. So, yan. Post sign at entrances in strategic places. So, like elevator, cafeterias, within ambulatory and patient settings, with instruction to patient and other patients with symptoms of respiratory infection to cover their mouth and nose when coughing or sneezing, and to use and dispose tissue and perform hand hygiene after hands have been in contact with respiratory secretions. So, yan. You also have to provide tissues and no-touch receptacles. So, dapat yung mga bin natin, hindi yung kailangan pang buksan by your hand. Yung pwede nilang apakan and then magbubukas na lang siya ng kusa. That's the way more mas okay, yung mga pedal operated. Provide resources instruction for performing hand hygiene. So, ngayon, halos saan makikita mo talaga meron ng sanitizer everywhere. Yung lahat ng mga wall halos. Like, within 10 meters, meron na naman. Tapos, within 10 meters, meron na naman mga sanitizer, which is really, really important nowadays. Okay, patient placement. Include the potential for transmission of infectious agents in patient placement decision. So, minsan, sa labas ng patient, the room ng patient, wala doon yung pangalan nila. Pangalan ng doktor nandun, yung attending physician nila. And also, we also put there on the door what precaution do they have or what precaution na dapat para sa kanila. The standard precaution, kung contact prec sila, droplet prec, or airborne precaution. So, yan, nandun lahat dun sa may labas ng door nila. Para alam mo, bago ka pumasok, kung anong klaseng protection yung gagamitin mo. So, for example, for droplet prec yung patient, dapat you have to use your mask. Pero required naman talaga ngayon yun. Or kung kapag naman airborne and contact, kasi kapag ikaw parang PUI ka, considered as PUI, you were advised, or you really need to wear PPEs, gowns with nurse booties, and yung parang shower cap, pero parang ang tawag doon nurses cap, yung parang protection sa ulo mo, face shield, N95. So kapag ganun ng mga N95 na, okay, pag alam mong PUI yung patient, and may right technique din kung paano maglagay nun. Patient care equipment and instrument devices. So, yan. Kailangan i-disinfect, sterilize mo rin. Hindi ko nababasahin isa-isa kasi you also have it in your PDF. You have the copy also. So, para mapabilis din tayo. So, alam niyo na, kapag may mga patient care equipment, katulad yung mga kailangan linisin nyo yung mga gamit nyo, like the stethoscope, your oximeter, your thermoprobe, para at least alam mo na malesen yung possibility na ma-infection yung patient mo or makontaminate mo yung ibang. Care of the environment. So, dapat may policies and procedures kayo kung paano mag-clean ng environment at kung paano magtapon sa tamang basurahan. Siyempre, pag infectious waste, kailangan sa ganitong color ng bin. Depende sa hospital policy. Sa amin kasi kapag black, yung mga normal lang na mga basura. Then, pag yellow, pag mga infectious waste like soil gloves, soil tissue, soil diaper, yan. Pag sa black and yellow naman, na mixture sila nun, dun mo ilalagay yung mga mga toxic na they call this, yung mga bagay. Nyari, mga pinagamitan sa chemo, dun mo ilalagay. Yan. And also, you have the use EPA registered disinfectant. So, depende kung ano yung required na disinfectant na ginagamit na tama. Na registered and recognized talaga. Okay, and also for the textile and laundry, kahit di naman na natin to pero usually yung gumagawa ito yung mga housekeeper ng hospital. So, handle used textile and fabric with minimum agitation. So, yan, meron din sila mga basic na mga precautions din na ginagawa dyan kung anong sabon yung gagamitin nila. Ito yung para sa atin, yung safe injection practices. Kung paano gumamit ng syringes in a good way, in a very safety way. Use aseptic technique to avoid contamination of sterile injection equipment. Do not administer medication from a syringe to a multiple patient. So, kapag isang syringe, isang pasyente lang dapat, hindi na dapat ginagamit sa iba pang pasyente. Even if the needle or cannula on the wrist is changed, so, hindi pa rin advisable. Dapat isang pasyente, isang needle, isang syringe. Okay? Needles, cannula, syringes are sterile, single-use items. So, once it opened, it's already unsterile. They should not be reused for another patient or used to access a medication or solution that might be intended for a subsequent patient. Use fluid infusion and administration sets for one patient only, and dispose appropriately after use. Consider syringe or needle cannula contaminated once it has been used to enter or connect to a patient's intravenous infusion bag or administration set. Use single-dose vials for parenteral medication whenever possible. Do not administer medication from single-dose vials or ampoules to multiple patients or combine leftover contents for later use. If a multi-dose vials must be used, both the needle or cannula and syringe used to access the multi-dose vial must be sterile. Do not keep multi-dose vial in the immediate patient treatment area and store in accordance with the manufacturer's recommendation. Discard if sterility is compromised or questionable. If you are in doubt what we should do, throw it out. Do not use bag or bottles of IV solution as a common source of supply for multiple patients. So, kung kailangan mo mag-aspirate doon sa IV bottle ng dapat gamitin mo yun sa isang pasyente lang. Hindi ka dapat lahat kayo doon din kukuha ng para sa iba't ibang pasyente. No. Okay? Infection control practices for special lumbar puncture procedure. Kaya mag-BMA yung pasyente. Bone marrow aspiration. So, you have also different kind of protection that you need. Kapag nag-a-assist kayo, usually doktor naman gumagawa ng biopsy, bone marrow aspiration or lumbar puncture, yan. You have also the same thing na mga protection na gagamitin mo. Worker safety, adhere to federal and state requirements. So, we have to adhere to the hospital policy kung paano ba nila. Kasi usually lang, bago ka pumasok sa hospital, magkakaroon ka ng mga, anong tawag dito? Orientation, kung paano yung safety prevention nila, mga policies nila, that you should know. Kasi, syempre, join ka na nga sa kanila. Okay, so now, the nurse explained to Mrs. Gutierrez that a physical examination of her mental status, hair, skin, nails, head, neck, eyes, ears, mouth, nose, throat, sinuses, thorax, lung, heart, peripheral vascular system, abdomen, and musculoskeletal neurologic system will be necessary to better assess her diabetes, anorexia, and insomnia. As she goes through the examination using the technique of inspection, palpation, percussion, and auscultation, she explained why she is performing each part of the examination. So, we have the physical examination techniques. We already know this. Inspection, palpation, percussion, and auscultation. So, yeah. Mga ganan yung mga techniques. So, we have here positioning the client. So, how do we position the client? First, we have the sitting position. The client should sit upright on the side of the examination table, on the home or the hospice setting. The client can sit on the edge of a chair or bed. So, this position is really good for evaluating the head, neck, lungs, chest, back, breast, axillae, heart, vital signs, and upper extremities. This position is also useful because it permits you for full expansion of the lungs, and it allows the examiner to assess symmetry of upper body parts. Some clients may be too weak to sit up for the entire examination, so they may need to lie down too and face up supine position and rest throughout the examination. So it's case-to-case basis. Other clients may be unable to tolerate the position for any length of time. So minsan, depende kasi sa pasyente. May mga pasyente kasi na pag masyadong matagal nakaupo, na nangangalay, kaya nasasaktan, especially kapag may mga hip, especially pag may mga case kami na may mga multiple myeloma, syempre naapektuhan yung mga spine nila or mga buto nila, so bisa nila na-tolerate umupo. Supine position. So this is what you call the supine position. So ask the client to lie down with the legs together on the examination table or bed if in home setting. A small pillow may be placed under the head to promote comfort. If the client has trouble breathing, the head of the bed may need to be raised. So kapag nahirapan huminga yung patient, pwede mo naman i-raise yun. Usually naman mga bed natin ngayon is automatic na pwede mo itaas, pwede mo ibaba. This is what you call the dorsal recumbent position. So how does it go? So the client lies down on the examination table or bed with the knees bent, the legs separated, and the feet flat on the table or bed. So this position may be comfortable than the supine position for clients with pain in the back or abdomen. So areas that may be assessed with the client in this position is head, the neck, chest, axillae, lungs, heart, ang daming hearts no. Heart, extremities, breast, peripheral pulses, and the abdomen should not be assessed on this position because why? The abdominal muscles here are contracted in this position. Sims position. So, paano yung Sims position? Ganito yung Sims position. The client lies on the right or left side with the lower arm placed behind the body and the upper arm flexed at the shoulder and elbow. The lower leg is slightly flexed at the knee while the upper leg is flexed at a sharper angle and pulled forward. This position is useful for assessing the rectal and vaginal areas. The client may need some assistance getting into this position. Clients with joint problems and elderly clients may have some difficulty assuming and maintaining this position. Usually ginagamit to yung Sims position pag gusto mo i-check yung rectum area. Standing position. So the client stands in normal, comfortable resting posture. This position allows the examiner to assess posture, balance, and gait. This position also used for examining the male genitalia. Prone position. So the prone position is the client lies on the abdomen. with the head to the side. The prone position is used primarily to assess the hip joint. The back can also be assessed with the client. In this position, clients with cardiac respiratory problems cannot tolerate this position. So, minsan nahihirapan sila ng ganitong position. So, in case-to-case basis, depende sa case ng patient mo. Knee chest position, this is how it looks like. So, the client kneels on the examination table with the weight of the body supported by the chest and knees. A 90-degree angle should exist between the body and the hips. The arms are placed above the head with the head turned to one side. A small pillow may be used to provide comfort. The knee chest position is used for examining the rectum. Ito rin, for examining the rectum. This position may be embarrassing and uncomfortable for the client. Therefore, the client should be kept in the position and for as limited time as possible. So, kung nakita mo na, hindi mo na dapat patagalin pa. Okay? Kailangan. Kasi syempre, napaka-awkward naman talaga ng position na to. Elderly clients and clients with respiratory and cardiac problems may be unable to tolerate this position. So, that's what the knee chest. Okay, so we have the lithotomy position. This one is very common. Pag lithotomy position, alam mo na yung parang ginagamit pag nanganganak. Ganyan. The client lies on the back with the hips on the edge of the examination table and the feet supported by stirrups. The lithotomy position is used to examine the female genitalia, reproductive tracts, and the rectum. The client may require assistance getting to this position. It is an exposed position, and the clients may feel embarrassed. In addition, elderly clients may not be able to assume the position for a very, very long time. So, therefore, it's best to keep the client well draped during the examination and to perform the examination as quickly as possible. So, nilagyan pa rin siya ng parang cover para at syempre, hindi masyado embarrassed sa part ng patient. Yan. So, we also have to do the inspection. So, yan. Yung mga common natin, the inspection, palpation. Kanina naman, the first one that we have is the physical examination technique. Yeah, inspection naman. So, paano ba yung inspection? So, inspection is involved using the technique, the sense of vision, smell, and hearing to observe and detect any normal or abnormal findings. So, general consideration for examining older adults. So, may mga position na may be difficult or impossible for the older client to do or to assume or to maintain because of the decreased joint mobility and flexibility. Therefore, you have to try as an examiner the examination in a manner that minimizes position changes. So, it's a good idea to allow rest period also for the older adult if needed. Some older clients may process information at slower rate. So, therefore, explain the procedure and integrate teaching in a clear and slow manner. I don't know if you can hear me well. Maybe I should put my mic like that. Or, I guess it's fine. Anyway, we go to the palpation. So, here, palpation consists of using parts of the hand to touch and feel of the following characteristics. So we have to know the texture, if it's smooth or rough, temperature, if it's warm or cold, moisture, dry or wet, mobility, if it's fixed, movable, still or vibrating, consistency, if it's soft, hard, fluid, feel, strength of pulses, if it's strong, weak, thready or bounding, size, if it's small, medium or large, and shape, if it's well defined or irregular, and degree of tenderness. So we have the three different parts of the hand: the finger pads, the ulnar and the palmar surface, and the dorsal surface are used during the palpation. Each part of the hand is particularly sensitive to certain characteristics. So we have the finger pads. Finger pads find discrimination of pulses, texture, size, consistency, shape, crepitus, ulnar or palmar surface. So this is it. The vibration, the trills, the fremitus, we can use that. It's really sensitive to that. The dorsal, we use it for temperature checking. Matirik mo ako, may lagdat ako, gagano sila. Gaganan. Okay. Now we have the light palpation. Palpation. this is what you call the light palpation. To perform light palpation, place your dominant hand lightly on the surface of the structure. There should be very little or no depression, less than 1 cm. Yan yung light palpation. Feel the surface structure using a circular motion. Kasi nagbabago ako ng position kasi nangangalay na yung mga paa ko. Kasi nakaupo lang ako sa kama. Anyway, depress the skin surface to 1. Ito yung moderate palpation. Depress the skin 1 to 2 cm na. 2.5 to 0.75 inch with your dominant hand. And use a circular motion to feel for easily palpable body organs and masses. Note the size, the consistency, and mobility of the structures you palpate. Deep palpation. How you do the deep palpation? Place your dominant hand on the skin surface and your non-dominant on the top of your dominant hand. So, yan. Deep na yun. Kasi may force. Ayan. Ganun yung deep palpation. Ito ba? Paano ba? Kasi hindi mo makita yung skin ko. Anyway. Ganun. Katulad nga sa picture na yan. Ayan. Okay. So, by manual palpation, use 2 hands placing one on each side of the body part. So, use one hand to apply pressure and the other hand to feel the structure. Note that the size, the shape, and consistency and mobility of the structures you palpate. Percussion. How you do the percussion? Percussion involves tapping of the body parts to produce sound waves. This sound is a vibration enable the examiner to assess underlying structures. So, percussion has several different assessment uses, including eliciting pain. So, percussion to detect if it's inflamed underlying structure. Kapag inflamed kasi yung area na pinapercuss mo, the client's physical displaying may indicate the client report that the area feels tender, sore, or painful. Determining location. Percussion also can determine the location or the size and the shape. So, percussion note changes between borders of an organ and its neighboring organ can elicit information about location, size, and shape. Determining density. Pwede mo rin i-measure dito yung density. Okay, so percussion helps to determine whether an underlying structure is filled with air, with fluid, or with solid structure. So, malalaman mo yan doon. Detecting abnormal masses. Percussion can also detect superficial abnormal structure or masses. So, percussion vibration. This is what we call bimanual palpation of the breast. So, dalawang kamay talaga yung gagamitin mo. Now, we have the direct percussion of sinuses. Kanan eliciting reflexes. Deep tendon elicited during the percussion hammer. So, yun yung sa percussion pa. Pero ito yung tawag dito sa direct percussion of sinuses. Ito yung blunt percussion of the kidneys. Ayan. Nakita niyo na? So, we have here, sound tone elicited by percussion. Siyempre, yung iba-ibang different sound yung mapuproduce ng, depende kung anong laman. So, sound, resonance, heard over part A and the part solid. So, pag intensity, loud, low, long, hollow, quality, normal lang. Pag sa lungs to. Hyper-resonance, heard over mostly air, very loud, low ang pitch, long ang length, booming ang quality. So, very possible may lang with emphysema. Pag yung sound ay timpani or heard over air, loud ang intensity, high pitch, moderate length, drum-like, it is possible na puff out cheek gastric bubble. Pag dullness, heard over more solid tissue, medium ang intensity, pitch medium, moderate length, quality, tad-like, diaphragm, pleural effusion, and liver. Flatness, heard over very dense tissue, we have the intensity so soft, high pitch, short length, and the quality is flat. So, baby possible, it will be like a muscle, bone, sternum, or thigh. Okay, we go next. Here, so ito yung indirect or immediate percussion of lungs. So, maraming mga technique, diba? So, yung mga doktor ginagawa yun. Mga ganang kasi ng mga percussion. The following technique help to develop proficiency in the technique of indirect percussion. Place the middle finger of your non-dominant on the body part of your going to percuss. Give your other fingers on the body part being percussed because they will damp the tone you elicit. So, yan. yung ginagamit ni Ate Girl yata, yan yung tinatawag ni indirect or immediate percussion of lungs. Yan, tapos you will gonna deliver quick taps and listen carefully to the tone. See, kailangan alamin mo pa yung mga tono-tono nila, high pitch, low pitch, low yung quality, diba? Ang dami pa. So, pero pag gina-practice mo yung araw-araw, I guess you will gonna be expert on that. Usually, gumagawa ng doktor. Auscultation is a type of assessment technique that requires the use of stethoscope, yung auscultate, to listen for heart sounds, movement of blood through the cardiovascular system, movement of the bowel. Kasi kailangan mo din ng stethoscope, mag-check ka ng patency ng NGT mo. Stethoscope is used because these body sounds are not audible for the human ear. The sounds detected using auscultation are classified according to the intensity, if it's loud or soft, if the pitch is high or low, duration, length, and quality, musical, cracking, raspy of the sound. So, yan. Ito yung assessment natin. Guide 3, how to use the stethoscope. So, may mga pagganun pa. Anyway, so we have the stethoscope is used to listen for auscultation for body sounds, as kasi body sounds that cannot ordinarily be heard without amplification. So, to use a stethoscope, follow the guidelines. So, first one is place the earpiece into the outer ear canal. They should fit snugly but comfortably to promote effective sound transmission. Minsan nagkakamali tayo ng paglalagay. Basta ang lagi nyo tatandaan, dapat yung step nyo nakaharap dun. Palabas. Para dito siya papasok sa tingang. Katulad ng headset. The way it was formed. Diba ganun? Palabas. Para madali siya marinig. Kasi pag baliktad yan, yung masyadong maririnig. Angle the nose down toward your nose. This will ensure that the sounds are transmitted to your eardrums. Use the diaphragm of the stethoscope to detect high-pitched sounds. So, minsan sarado yan. Kaya dapat, minsan kasi pag kinlose mo siya, mamaya sa kabila na side yung open. So, dapat, bago mo siya ilagay sa pasyente, i-check mo muna kung tumutunog talaga. Use the bell of the stethoscope to detect low-pitched sound. So, yung bell na part, doon mo ma-hear yung low-pitch na sound. Some do's and don't na kailangan mong gawin. Warm the diaphragm or bell of the stethoscope before placing it for the client. Kasi minsan may mga pasyente na sobrang paghawak mo na, ay, malamig. Nagugulat kasi malamig. So, kailangan minsan pinapainit pa yun sa kamay mo. Ako usually, ang ginagawa ko, tinatap ko kasi para alam ko kung gumagana siya. Pero hindi ko na masyado pinapalamig. Pero, mas tabi dito, you should at least warm it with your hand. Explain what you are listening for and answer any question the client has. This will help to alleviate anxiety. Alleviate, not elevate. Alleviate anxiety. Do not apply too much pressure when using the bell. Too much pressure will cause the bell to work like the diaphragm. Avoid listening through clothing which may obscure or alter sounds. So, much better talaga na tataas mo yung mga damit kung gusto mong mag-auscultate. Okay, now we're almost done. This guideline should follow as you practice the technique of auscultation. So, you have to eliminate distracting or competing noises from environment like radio, television, or machinery. Siyempre, baka mamaya madistract ka sa napapakinggan mo. So, much better na tahimik. Pwede mo sabihan si client na, ma'am, wag ka muna magsalita ha, check ko muna. Kasi minsan pag nagsalita sila, naririnig din natin yung boses nila. Mas malakas pa kaysa sina-auscultate natin. So, we also have to tell it to the patient para at least ikaw din hindi ma-alter yung auscultate na sound. Ano kaya ito? I have a message. Okay. Okay, you have to use the diaphragm of the stethoscope to listen for a high-pitched sound such as normal heart sounds, breath sound, bowel sound, and press the diaphragm firmly. Use on the body part being auscultated. Kasi makamaya naman, hinayaan mo, hindi mo na hinawakan. You should hawakan mo rin para marinig mo talaga mabuti. Use the bell of the stethoscope to listen for low-pitched sounds such as abnormal heart sound, brut. I don't know why do you pronounce that. Bruh. Abnormal loud blowing or murmuring sound. Hold the bell lightly on the part that being auscultated. Summary. So we have here now the summary, guys. So we have to collecting objective data is essential for complete nursing assessment. The nurse must have knowledge of and skill in 3 basic areas to become proficient in collecting objective data. So what do we learn from all those things? We have to have like the necessary equipment and how to use it. We have to prepare the setting, oneself and the client for the examination, and how to perform the 4 basic assessment technique. Collecting objective data requires a great deal of practice to become proficient. So proficiency is needed because how the data are collected can affect the accuracy of the information elicited. Okay, so that's one for our part 3. Now we're gonna be on the part 4, so I'm gonna do it later. I'm gonna send it to you too, because I owe you like 2 classes. So thank you for listening, and I hope you really watch it until the end. Okay, because this one is really important para at least sa next exam nyo, may masagot din kayo. And good luck, guys. Thank you for your time. Bye bye.